Good morning and welcome to the campus of the University of Arizona. We're coming to you live on the U of A's YouTube channel from the Health Sciences Innovation Building. We have a panel here to discuss some of the work being done at the university, working on the new normal when it comes to the COVID-19 virus. And panelists, we're all social distancing and we have really good ventilation here, so I think it's okay to take off our masks. Sure makes it easier to talk. This is the sixth in the series of community forums, of some briefings that our president, Dr. Robbins, has established to help keep the community here in Tucson, and actually all over the world, up to speed and up to date on what's happening here at the University of Arizona, the progress being made, some of the challenges that are happening. I'm Nancy Montoya, and I'm the Public Information Officer for a new task force that Dr. Robbins established. He's bringing together people from the community who are crisis experts, along with the tremendous brain power that we have at the University of Arizona. The two groups are working in tandem, trying to find solutions, and once those solutions are found, how do you implement that and make it part of everyday life here on campus, which is actually kind of like a city of 45,000 people? We'll introduce the panelists in just a minute, but let's go over to Dr. Robbins now, who will give us an update of the many moving parts going on here at the University of Arizona. Dr. Robbins.
Nancy, thank you, and good morning, everyone. Thanks for joining us for the sixth event. We've moved locations out of the beautiful indoor practice facility because our athletes are starting to return to campus. They're going to be undergoing tremendous amount of testing as they come back, and we can get into that later. But I thought I would start by just highlighting how things have changed even in the past week. Arizona is now a real hot center for COVID-19 cases in the United States, and Dr. Carmona, who's leading our incident command reentry system here at the university, he and his team, as we all are keeping a careful eye on the number of cases that have occurred here in Arizona. A lot of new developments. The number of cases obviously are going up, and we anticipated that there would be an increase in the number of cases. I didn't quite anticipate it would be this tough, Rich, and it continues to go up. I think the governor yesterday made some strong recommendations about covering your face when you're in public, and our mayor here in Tucson, Mayor Romero, last night basically mandated face coverings in public for all individuals. I'm very supportive of this. I think you'll continue to hear us multiple times in every one of these briefings every week emphasize good public health hygiene. Wash your hands frequently, disinfect them. I see a bunch of dispensers, as Rich knows, and Dan knows, when we go in to see a patient, we gel in and gel out or wash our hands. And I think that that fair and just culture in a hospital empowers everyone, even the patient or even anybody on the team, to remind everyone. I noticed, Dr. Carmona, you didn't wash your hands or gel in before you touch the next patient. I think we've got to translate that into the community, and everyone needs to be cognizant of the fact that we all have to do our part to try to prevent infection, especially now that we've seen this tremendous uptick in cases here in Arizona and indeed in southern Arizona. The number of hospital beds, the number of ventilators, ICU beds that are available. Rich updates me every day with his team about what's available, and we'll get into a discussion later in the panel, but I just wanted to highlight the obvious, that we're now into a period of time where all of these public health hygiene responses are going to be important. Wash your hands, Cover your face when you're around other people if you can't physically distance. Stay away from people as much as you can, particularly if you're vulnerable. And you are of a certain age, you have comorbidities, you're being treated for cancer, you're being actively immunosuppressed. Stay in place. Stay safe in your own environment and just don't go out. I know that there are times when people who are getting chemotherapy, for instance, have to come to the hospital. They need to have their face covered, they need to wear gloves, they need to stay away from as many people as possible. And we hope that that's going to translate as we contemplate the reentry into campus here, that everyone who chooses to come back to campus will take it upon themselves. I think we're working, Nancy, on a Wildcat pledge that will focus on things that the athletic department talk about all the time. I can, I will. I can, I am, I will. May have got that wrong, but you'll see more about that coming out. And I think it's a reminder to everybody that we have the determination individually to make a difference for society. So again, washing your hands, covering your face, stay as physically distanced as you possibly can from as many people as possible. And then of course we're going to test. We're going to contact trace. You're going to hear more about that from some of our experts. Dr. Joyce Schroeder's here with us today. Dan Dirksen, who has been canvassing the entire beautiful, very large state of Arizona, setting up testing sites all across the state. It's really going to be important. But without adequate testing and good testing, there's Dr. Rosales, Cecilia Rosales, and Dr. Michael Hammer have come up with an algorithm that we'll be sharing through our COVID-19 website about test all, test smart. As you all know, we've talked a lot about the antibody test that we've developed here. I think that's instructive because it gives us a insight about the incidence in the community, and it'll help us as vaccines are being developed. But I also want to emphasize, as I do every week at these briefings, we're going to be in this situation for the long haul, meaning at least another year, I think. The experts can tell us more about their view and update around development of vaccines, but we need that before we can get back to the quote new normal that we're all experiencing. And I also want to emphasize, as I will do every week, we need to get people vaccinated for garden variety influenza before we have a vaccine for this COVID-19 virus. A couple of things that we've made decisions about, and I wanted to, we've been getting input, people are watching what we are saying, is about the great flexibility we're going to offer staff, faculty, and students. There are some things, however, some jobs, for instance, doing a heart transplant. I don't know how you can do a heart transplant if you're a heart transplant surgeon without actually coming to the hospital and showing up and doing your job. There may be cases where individuals who are at very high risk, we're going to encourage them. We can't prevent them from coming to work. We'll try to put the safeguards for the most protective environment we can establish on the campus, but we can never de-risk this to zero. And I think everybody understands that. But as we go through the decision about whether we reopen, these are going to be important questions that we have to answer. We're going to have to be cognizant of how many cases there are in the community. If our ICUs, if our hospitals, if our medical systems are overwhelmed, we're simply not going to be able to come back to campus as we envision. And this is a discussion that Dr. Carmona and I had early on as he graciously accepted this mission to come and help us bring all the assets that we have in the university and the community, working with CDC, WHO, government officials, to try to get us as informed as we can about making the decision to go forward. But I just wanted to emphasize to faculty, staff, and students, there are going to be some things that are not going to be able to do without showing up in person. I have a neighbor that I talk to occasionally who is an engineering student. And I said, well, you know, one of the things I said early on was, how do you actually do organic chemistry lab on Zoom? You know, because one of the things you do in organic chemistry lab is you're giving an unknown sample and you're meant to say what the sample is, whether it's benzene or whatever it is. I just don't know how you do that. Now, we got through the spring semester, but going forward, if you need to do these labs, I think you have to be on campus. If you choose to defer until later, that's okay. But just realize that you can't get credit for that course if you're not here. Gene Block, the chancellor of UCLA, termed the performers that come back to campus, whether it be people who are doing research or have to do lab work or actually have to be here to do their work. So I don't know how we're going to be able to accomplish getting people credit for organic chemistry lab if they're not here being able to do it. I could envision that there's a way to do it in your kitchen at home in Florida, but probably not the safest and most productive way to get that experiential learning. Other things, this neighbor of mine that I referenced earlier said, yeah, the way it works, you know, mechanical engineering lab is we didn't actually do the experiments. They gave us the data set as if the experiment had been done, and we were instructed to write a lab report. Okay, that was good in a crisis mode in the spring, but going forward, I think we're going to have individuals here. We'll have to have enough faculty to be able to teach these courses that require performers to be on campus. Likewise with jobs for faculty and staff, if there are cases where you just simply can't come, or we would encourage you not to come, there's a whole process that Provost Folks has laid out to be able to go through, to work with your supervisor, to work out how you could teach your course online. But if you have to do a heart transplant, maybe you have to say, well, I can't do that. I'll be at home and somebody can help you see telehealth patients, for instance. Or the extreme measure could be that you just decide that you'll take a leave of absence from the university until there's a vaccine. So I think all of these things we want to be as flexible as we possibly can, but realizing there are certain limitations to that flexibility. I think, Nancy, I'm going to turn it back to you because I know we have a short time and we've got a lot of great people who have a lot more to say.
Thank you, Dr. Robbins. It is a matter of the new normal. And as we talk to our panelists, be thinking a little bit about the pandemic fatigue that many of us are feeling. People you work with, your family, and perhaps give us some thoughts on that. Introducing you all to the panelists here. From left to right, we have leading the Reentry Task Force and working together with university administrators is Dr. Richard Carmona, whose expertise as the 17th U.S. Surgeon General makes him uniquely qualified to lead this effort. Plus, Dr. Carmona has been a member of the faculty here for some 30 years. He's not just faculty, he's family. Next to Dr. Carmona is Dr. Joyce Schroeder, who heads up the university's Molecular and Cellular Biology Department. Her department, I understand, may be breaking some news this morning, so Joyce, I'm excited to hear what you have to say. And we're also fortunate to have Dr. Daniel Dirksen join the panel. Dr. Dirksen is the director of the university's Center for Rural Health. Also, we make an effort every time we do these panels to invite a student along to be with us. And if you could tell us your name and tell us a little bit about yourself.
Sure, yeah. My name's Tanner Toshwe Maisua. I'm a second-year student here at the Mezcov College. I am in the Masters of Public Health program, and my concentration is in Health Service Administration. And I'm working on a project with one of my preceptors, Dr. Rosales, on creating a curriculum for Maricopa County on contract tracing.
And we'll get back to Tosh in a little bit. But Dr. Carmona, let's start off with you on this end. The ICS is making lots of gains these days. Please remind us again, what is the ICS and what is the mission and how does it integrate with university faculty, scientists, researchers?
Thank you, Nancy. Happy to comment. And Dr. Robbins has given us a lot of information this morning about the things that we are doing to mitigate transmissibility, but also to hopefully be able to open in some form where students can have a joyous experience in education and so on. When Dr. Robbins reached out to me, it was a couple of months ago when he realized that he had a wealth of information from the extraordinary faculty that we have here at the University of Arizona, covering just about every discipline, you know, from A to Z, literally. Right. And he realized that we have to figure out a way to operationalize this, to put this into a plan. And so he called me in, and I said, well, I'm kind of busy. I don't think I can do this. And the next day I was doing it. So he's a pretty persuasive guy. But, you know, he had a very compelling case that, you know, he was very proud of the faculty and all they had done in the research under our provost and senior leadership. But like he said, how do I deal with all of this information? How do we operationalize it? And I mentioned to him that, well, there's a process we use at the highest levels in government called an incident command system that deals with any and all hazards that a community may face. And so when you're faced with the health, safety, or security of a city or a nation or the world, this is the organizational structure that's used. And so he didn't give me a pass on it. He pummeled me with questions for about a week and actually made me make my case by bringing in literature and demonstrating that this would be the best way to organize this complex amount of scientific information that had come forward. And since that time, that's what we've been doing. We stood up the incident command system, working jointly with the faculty, my peers. As I said, I've been a faculty member, professor for 35 years here at the university, so it helps that I know the landscape. And during that time, what we've been doing is to work closely, like every one of our incident command leaders is paired with a senior faculty member or administrative person so that it's a joint operation. It's not just us telling them, it's us learning from them, but also us figuring out how to best operationalize all of the challenges that are before us. The challenge that the president gave us was to tell me, based on all of the information you can aggregate from our faculty and your expertise in this area, how, when, and if I can open this university. And everything's on the table. So what the president said to me, I don't have any preconceived notion. He said, I want to know the best practices to do this. I want to make sure I'm absolutely creating the best environment. And I realize that this is going to be a moving target. Because as the president said, every day we give him a situation report based on 24 hours of data that covers the city, the state, the nation, and the world. So we can see where all of these patterns of incidence and prevalence are moving. In those discussions that our team has with the president on a daily basis, he then gives us further direction and questions to dig a little bit deeper. Everything from the type of testing and how often should we test, what are the risks, what are the benefits. So I'm happy to report that, you know, the op tempo is pretty swift. There are long days and nights, and often the president's still having meetings with us late into the night until he gets all of his questions answered to be able to make the best decision. So the challenge for me and my team and our faculty is to ensure that every day the president has the best information, and at some point in the next few weeks, he will get a plan from us that's going to identify all of the input from our faculty, our recommendation to him as to how and when and if we move forward so that he can make the best informed decision as to how to create the safest environment for our students to learn. And the spectrum is from digital to completely open and everything in between. So again, our feet are being held to the fire on a daily basis to provide the best information. And as much as we feel proud of what we're doing, he always figures out a couple of questions we haven't thought about, so we go chasing those for him as well. So it's, I mean, we're thrilled. My team and I are thrilled to be part of the team the president has put together. in hopes of answering all his questions. And still, the weight of this weighs on us every day because these decisions are going to be so important and the variables change. I have every confidence in our faculty and the team to be able to provide the best information, but every day it's a new story, every 24 hours with the incidence, the prevalence of cases, mortality. As the president said, how many beds do we have? How many ventilators do we have? You know, what's the status of our EMS system? Mutual aid agreements with other communities if we have emergencies. So that's the challenge, the moving target that keeps all of us up at night. But I'm confident we're going to have the best information for the president so he can make his decision in the near future.
Well, on paper, the ICS works. Your experience, the ICS works.
Yes.
But what about right now, today, on the University of Arizona campus? Is the ICS working?
Yes, absolutely it's working. In fact, it really is, we have a CERT, which is an ICS that the university has all the time, that in fact we set up a couple of decades ago, my colleagues and I, because we had students that wanted to build an EMS system.
What is a CERT?
Well, the CERT is the emergency response teams for the university. So it's an ICS that the team has, that the university has, that can be stood up. It comes under the direction of the president, who's delegated authority to the police chief. But any and all emergencies that pop up, this team will work, and it can surge. It can bring in local fire, police, and others, or it can handle it locally. That's the greatness of the incident command system. It's scalable. It can be a small event, or it can be a global event. So, you know, we used it for earthquakes, tsunamis when I was Surgeon General. We use it in the war zone and aggregating lots of diverse populations of people and science and so on. So it's the same system we use here. And CERT has been here for a while, but what's interesting is the public doesn't realize it, that when they go to one of our basketball games, when they go to a football game, there's an incident command system embedded when large groups of people come together. And there's EMS waiting, there's law enforcement waiting. So all of the pieces are there, so if something happens on campus, there's an immediate response. So incident command is part of the culture here. It's just that it's invisible for most people. But it provides a benefit and reassurance to the president that he can respond at a moment's notice for any threat that the university is encountering.
Thank you, Dr. Carmona. Dr. Schroeder, Dr. Carmona is dealing with a long history of a process that he works with, the ICS. You are dealing with a brand new process, and that is something called COVID Watch. And I'm not even going to try to explain it. I'm going to turn it over to you so that you can explain what it is and what difference it could make with dealing with the pandemic.
Well, thank you. I'm really happy to be able to tell you guys about the progress that we've been making in this arena. So first off, I have a little announcement to make that we have formalized our collaborative arrangement with COVID Watch, which is an app developer that is developing an app for exposure notification. And we're talking about exposure to COVID-19 and notifying the owners of the app that has happened. But before I get into the details of why we chose to partner with COVID Watch to test their app, I first wanted to remind everybody how this app is intended to integrate into our public health response. So when dealing with infectious outbreaks, public health has a number of jobs to do to try and contain those outbreaks. They include testing individuals to discover who has the infection, and then tracing who those individuals have been in contact with, and taking those groups of people, putting them into isolation away from the rest of the community. And by doing this, public health has the ability to really suppress the spread of infection. I was reminded when I was driving in this morning, seeing the terrible fire that's spreading through the Catalinas behind the university. When you have a fire raging, you have little sparks going off all the time. And if you have the ability to take those sparks and put them out before they have the chance to spread again themselves, you can do a lot to control that raging fire. And that's the best analogy I can think of to the use of contact tracing to suppress the spread of infection. Public health has been doing this. They do it really well. And they do it in a manner that is called manual contact tracing, where a specific individual has to call an individual who's been tested positive and find out who they've been in contact with. Then contact those people one by one. And as you can imagine, it's a really intensive process for the time that it takes, the training that it takes. In light of that, and I just also want to point out, we are doing that. The U of A has invested a lot of resources. The experts in public health are massively expanding our ability to do manual contact tracing. So that is happening at the same time. But similarly, we have the opportunity to use technology to try and really scale up our attack against this disease. And that technology comes to us in the form of exposure notification apps. So what these are apps on smartphones that will talk to each other, and the smartphones will know when they've been in contact with other smartphones. When a person gets a positive test result, that information is entered by that person into their phone, and then the phones communicate with each other. And so you know when you've been in contact with someone else who has tested positive.
Dr. Schroeder, one of the questions that I think many have sent us since the whole idea of this kind of app surfaced is, what about privacy? Many students especially are concerned that somehow this is not only tracking whether there's a virus, but it's also tracking other personal information. Tell us about that.
Thank you. That's a perfect segue to exactly what I wanted to bring up. So now that we have a context in which we're thinking about the exposure notification as a tool that public health can use in contact tracing, we need to think about, why did we select COVID Watch to partner with? There's a lot of apps out there. There are a lot of options out there. There's a lot of marketing going on, trying to get different organizations, such as the University of Arizona, to select their app. Why use their app? So the team that we have built here at the U of A, which is built of public health officials, applied math people who have expertise in coding, in privacy, in legal, we have all these people on the team. And we have set up a list of requirements for things that we want to look for if we are going to select an app to partner with. And there's a lot of things. I think the list has something like 11 things on it that we're looking for. But we can sort of make some of them the key entry points. Those key entry points are privacy. So we are using, this app is using low energy Bluetooth, and it does not do any location tracking. It will not know where you were, has no idea where you were. It also has anonymity. It's not going to collect any data on you. So when people say, what are you going to do with the data about me? We're not collecting any data. No data, nothing. All the phones are doing is talking to each other about who they are. That's it. They don't know who you are. You could take your iPhone and you could put it on your pet. It wouldn't know the difference. It's not collecting any information about you. The third thing that's really important to us is that the notification comes from an authorized health authority. Not anybody can put this information in that you have a positive test and start the process going. It has to come from the state of Arizona, Department of Health, which would send that information down through the counties who control that information, and only then would a key be given to that phone for that user to be able to put it in to say you have a positive result. And this is super important because it prevents any sort of malice being associated with the phone, of people putting in false results. So those three things are incredibly important to us. There's a lot of other things that are taken into consideration. For example, is this an app that's going to drain your battery? Will you want to keep it on all the time? That's a really important consideration. And COVID Watch passed all of these considerations in addition to many, many more. And so we chose them very carefully, very judiciously, and we have now been working with them for about a month to make sure that they are the partner that we want to use. And so today we began the testing of the app. And I really want to point out the fact that we are testing the app. We are not deploying the app yet because there's a lot of questions. This is brand new technology. So our group has put together this really beautiful, rigorous scientific analysis to find out if this app will do what we think it's going to do. And over the next month, they're putting it through all the paces to see what it's going to do. And once we get that data, then we're going to come back together and think about it again and decide if we want to go forward with it. But just the beginning of these testing and the formalization of our collaboration is really exciting for us because we think this is the partner that is going to really help us come back, really going to help us attack this from a public health point of view and bring us back together again.
A couple more questions. I can't help this. Number one, can you opt out of the app? Let's say you get into the app and you decide, you know what, this is not for me. Number two, when will it be available if everything goes the way you believe? And will it cost anything?
So as far as opting in or opting out, every single part of using this app is opt-in. You will not be made to download it. You download it on your, by your own choice. You turn it on. You turn on your Bluetooth. You keep it on. All those are opt-in. Someone sends you a positive test, you don't even have to enter that positive test if you don't want to. It's your choice to enter that positive test. Once a test comes to your phone or an exposure comes to your phone, a whole set of information will be presented to you about what you can do with that information. Contacting campus health, putting yourself in isolation, different issues for testing. All of that is embedded. And importantly, we have a really great group on campus who are involved in educating all of us as consumers about what this is, what it can do, how to use it, what to do when you get a positive test result, all of those issues.
I think, Dr. Robbins, you had a question for Joyce?
Yeah, so Dr. Schroeder, we're all very excited about what you're leading here. Can you just make a comment about, until this is ready to go, and maybe just comment on what other team members are doing with, I'll call it old-fashioned, but face-to-face encounter notification.
Face-to-face contact tracing. So that the face-to-face, I'm guessing you're asking about, and that actually is contact tracing, where an individual contacts you and tries to trace who you've been involved with. So we have wonderful colleagues in public health, and this is being led by Kristen Progreba-Brown, who has a program already established in public health called SAFER that is interacting with Pima County and other health authorities, and they are massively scaling up the number of people that they have to do this right now. So she is hiring all of the trainers who will be hiring all of the actual tracers who are going into the public and contacting people and getting that done. But as we can all imagine, the number of cases that we have testing positive is a problem when you have to do this one by one. And the ability to scale up this way through digital exposure notification is really going to help us. We hope it's going to be a game changer. We have to test it first. We're approaching this as a scientist would approach this, which we are. We need to test it and make sure it's doing what we expect it to do. But if it does, we really hope it's going to be a game changer.
Great. Let's turn over to Dr. Dirksen now. Your specialty is in rural health. Will something like this app help you do a better job with the folks that you are working with out in the rural communities of Arizona?
Yeah, I think this tool, along with others, will really give us a much better tool than just shutting everything down. We have to have more precise tools to do a better job. I've spent, over the last few weeks, put about 3,000 miles on my vehicle driving around, helping set up some of our COVID antibody testing sites. We have now more than 30 sites in all of our counties. This was really important to get out and meet with the nurses and the physicians and the administrators. We're a land-grant university. We're expected to be a resource for the state as far as technology, new ideas, innovation. But this pandemic, if there's any positive side to it, it's absolutely changed the way we teach, the way we learn, the way we deliver care, both virtually and in person. There's nothing that has accelerated telehealth as this has. We're seeing every single clinic that I went to, every single one of the 15 critical access hospitals around the state has moved some into virtual treatment, and they've had to because people with diabetes, hypertension, high cholesterol, they still need care. But many individuals were reluctant to go in and be exposed to people coming through the emergency department or the inpatient services to this very highly transmissible disease. So the virtual visits, every site has done that. Our state has really led the way in having Medicaid pay for those types of services. Eventually, a few weeks ago, at the federal level, now Medicare is paying for those visits, and we expect soon that the private insurers will be part of that. We've now done over 15,000 serum antibody tests for COVID-19 around the state. We're using that data in real time to help guide some of our policies. We think that this test will be particularly valuable, as Dr. Robbins mentioned, as we develop a vaccine and test it. Are individuals developing an adequate antibody response from the vaccine? How long, once you have those measurable antibodies, would that protection last? This is absolutely a critical role for the University of Arizona and our academicians, our students, our residents, our trainees across our 5 colleges that really get into how can we use data to better inform our policy interventions. So as we focus a bit internally on reopening and the importance of that, our students come from all over the state, and they go back all over the state and beyond our borders to other countries, to other states. And we have to make sure that we can do that in as safe a manner as possible, protecting their health, their families when they go home for Thanksgiving or Christmas. We have to make sure that we're using the best data available to inform those types of policies.
Now, I grew up in the Clifton-Morenci-Duncan area, which is Greenlee County and the Graham County area, and you can't get much more remote than that, I assure you. There's always been a feeling, though, of isolation, that we're not getting the kind of care that the urban areas get. What does this telemedicine mean to those areas, and are there any counties that are doing an especially good job?
Well, Dr. Robbins and Dr. Carmona and some others of us visited Socoton yesterday, or the day before, I guess, and we saw their incident command system on that reservation area. I think they're doing a particularly good job of identifying, connecting, reaching out to their elders, to those with 1 or more chronic diseases, to make sure they're getting the medications they need, the groceries they need. And when they have a positive, I think they have a very sophisticated system of contact tracing and follow-up. I'm proud to say one of our MPH graduates from our program, Candy Prestone, is there in their Department of Health and leading some of those efforts to make sure that they stay connected with their fellow community members. Every business, every education institution, every health department has to go to this precipice, and it's a little scary of saying, how do we reopen? How do we do it? We have to get people back to work. We have to get people back to teaching. We have to get our students back to taking their courses and being able to graduate and get out there and provide the services that we really need in these underserved areas. So we're all facing those things. We're going to have to get much better real-time data, as we've been trying to do, so that it informs the leadership, but also the faculty, the staff, the students, in how to make the best decisions. But that also means we have to have some flexibility between communities, between education institutions, to share best practices, but also to adapt to changing circumstances on the fly, as we're doing right now. These tools are really going to help us do that more precisely.
And because they can adapt, it's going to be a lot better. So far, we've heard a lot about what's happening right now and the research that's happening right now. But Tosh Mehasua, did I get it right?
It's pretty close, yeah.
Pretty close, yeah. I'm not great with names sometimes, Tosh. You're working on research that is aimed at the future. It's aimed at creating a curriculum for contact tracing. Can you tell us a little bit about your research and why you think it's important?
Sure, yeah, I would love to do that. And first off, just some background in the program, my MPH program. I have the opportunity, U of A gives me the chance to work on something like this, a summer internship where I can work with my preceptor, Dr. Rosales, with a major department like Maricopa County Public Health Department, which is the largest state local public health department and the 6th largest in the nation. So it's a real honor to work on a curriculum that's going to be going directly to them. But more specifically on what I'm helping with is there's a lot of faculty here at U of A that are adding in their own modules and presentations that will be put into one course that Maricopa's new contract tracers they're hiring, since they've hired so many more in the face of this crisis. And something cool about that is a lot of them are actually new grads from the college that I'm graduating from. So that's kind of a continuing support line that I think U of A is having, which is really cool to see from a student point of view when I want to look to the future of seeing what I could potentially do afterwards. But a lot of these modules are really interesting, and creating them specifically, for the Arizona and their needs is touching on the political environment and the economics of behind it, things that will kind of add to the weapons a contact tracer should have if they really want to do a good job of going forth into it. And it's really cool because I'm learning and almost being trained myself by going through this and developing it, and then putting it on an online open source thing that everyone else could potentially come in to learn more about it.
So with your research, not only will you be doing the physical learning, the curriculum for physical contact tracing, you'll also be maybe incorporating technologies such as that of Dr. Schroeder.
Yes, exactly. Depending on this could be, it's going to Maricopa currently, but this could be going to other counties where they might do a different system of how they collect it, and this technology you have with the app and things like that is really important, to put out those sparks, as you would say, as the fire analogy. And yeah, it's a cool thing because, coming from a student, I can really put into practice these competencies I learned in my first year, especially into my concentrations, and just being engaged with a major stakeholder that U of A is in the community and giving back is something that, I really like it on the academic side, but personally, coming from a Native American background, it really helps, support these indigenous populations that are so diverse and spread out here in the southern Arizona area.
Let's talk a little bit about the indigenous community. Will contact tracing and the curriculum look different up on the Navajo reservation, maybe over in the Tohono O'odham, than it does in maybe Phoenix and Tucson? And will your curriculum be adaptable to those different areas?
I can't really speak to that, but they will have it. Cultural humility, I think, is a big thing that we'll be practicing in that. And then the teachers, since this is such an ever-moving process and everything changes day to day, they're set up on the online program. So if there's any updates or major changes, they can be able to go in and add in new information that's relevant that contact tracers might be able to speak to that would be more up to date than last week or a month ago.
Wonderful. Wow, this is neat. We'll open it up to anybody on the panel. If you have questions of each other, there's a lot of good and new information. Any questions from you folks to you folks?
I would ask Tosh and the research that you're doing, which is so important to our endeavor here moving forward. I know there's many other students that I've encountered not only in public health, but even in the hard sciences, where there's research being done and the students having practical, application. I know when we spoke just a few minutes ago, most people looking at public health would say, well, what does that have to do with an incident command system, and how does it come together? And yet, there's no way to manage something like this without an organizational structure. And I would say that I think the opportunity you have is during this terrible time is extraordinary because of the real world experience that you're getting. I mean, you're contributing, everything you're doing is contributing day to day to my team and all of our faculty to advance us to deal with this issue. And the contact tracing, as the president has pointed out, is one of the most important aspects of what we're doing. Are some of your other students involved in this, your fellow students as well?
Yes, I have some people in my cohort who are also involved in this project and other aspects of this thing. As you said, it's kind of tragic what's happening, but this is probably the most real-world experience as you could get as a public health student, and taking advantage of that and the resources that the University of Arizona has with its partners to be able to work in a real-world experience to apply those competencies that we have in the classroom is really valuable, and I'm really thankful that I'm able to have that and be engaged with it as a student even before I get into the real world.
Dr. Robbins?
Yeah, so my hope is that in the coming weeks, we're going to continue to inform people about where we're headed. I think we've made some administrative directives, I won't call them policies, but guidance to the campus, whether it be around the flexibility about whether to come back face-to-face and what some of the consequences of those decisions would be. The ability to test. I saw for the first time yesterday, finally, a great algorithm that Dr. Rosales and Dr. Hammer have put together around testing, and maybe we should bring them with us next week to talk about that. You know, I've been talking a lot about the potential for using antigen testing as a screen. You can do it immediately on site, and then for any positive there, that you could go to PCR testing for a more definitive diagnosis. Again, as Dan mentioned, the antibody test is going to be important. But through the encounter notification, i.e. contact tracing, to the treatment phase, I'd like, Rich, maybe for you to comment about what your team has been doing with Chris Kopak, because we've got athletes back on campus, we've got researchers. If we get a positive case on campus, where would we isolate them, and talk maybe about Babcock and what your team is doing to get us ready for, and the capacity for that, because one of the rate limiting factors for us is, one of the early things that I was concerned about is, if we were to come back and there's a second or third wave that comes, obviously we have to have ICU beds, we have to have hospital beds, but we also have to be able to isolate students, faculty, staff. How would we do that? And if the system gets overrun, then the decision would have to be made to send everybody back home again.
Let me interject here real quick for our viewers. Chris Kopak is the head of facilities, and he knows every single closet, every single inch of this campus. Dr. Carmona?
Well, I can't praise Chris enough, because he's an extraordinary individual. He understands the incident command system. He works with Chief Danny Sharp, who is running our logistical section. And to answer the President's question, it really goes to the logistical side of what we're doing besides the operation. This city of Tucson has another city within it called the University of Arizona. And although these decisions are not really visible to the public as we go along, and Bobby would say to us, well, what happens if a student becomes ill, or we suspect they're ill, or they test positive? There's all these contingencies that are built into the plan, and one of them is, where would we house them? We have an infirmary set up with a capacity probably of up to about 200, depending on how we house the students there, depending on what their specific diagnosis is, if they're test positive, if they've been exposed and they have a high risk. But bottom line is, we have a plan where students can move into this Babcock, which is a dormitory essentially, that will be set up specifically. And so really important to talk about the granularity there, because some of the questions nobody even thinks of. Well, what happens when you put in young men or women into a building like this and they're positive? What happens with the air circulation? Are they just circulating the germs around the building? And we posed that to Chris Kopak and his folks and the engineering folks at the university, figured out how to work the HVAC system, put filters in it. There's other options we can use as well, ultraviolet light, which also works well to kill the virus. So a lot of things that are going on behind the scenes to make an optimally healthy, safe environment should a young man or woman need to be sequestered because of the risk that they possess. But during that time, they can still go to school, because the President insisted that we make sure that classes can be attended via digital platform, so they're not going to lose the education during that time. In addition, student health is involved. So student health will be watching and working with us to make sure these young men and women are getting the care that they need. Most of the care is really make sure they're eating, make sure they're not getting dehydrated, pain control, because there is no specific treatment for this disease. We're waiting on a vaccine. That's a little ways away. There's experiments going on. For those of you who are interested, you could go to clinicaltrials.gov and see dozens and dozens of experiments that are going on now around the United States. on different drug combinations to see what might work. But in the interim, we have the best practices that we will bring forward to ensure that our students are treated well and safely during the time they're here, and they don't miss their educational experience even if they are in the infirmary.
Thank you, Dr. Carmona. Before we wrap things up, Dr. Robbins, a couple of things. Yesterday, Governor Doug Ducey issued a new ruling saying that individual counties, and I believe it's also cities, municipalities, can make their own decisions when it comes to wearing masks. And our mayor has indicated that she is going to require mask wearing. How does that impact the university and some of the policies?
Well, we had a policy that, an administrative directive that came out that would essentially do the same thing. The only caveat was that outside we had said we would want you to cover your face if you couldn't maintain proper social distancing, because someone who's going out for a run, it's a little tough to run or even bike when you have a face covering on. But I'm supportive in this critical period of the mayor's decision, and we will, of course, comply with what her directive is for the campus until she changes it.
There's also been a lot of community support that's come in for the university. Can you tell us a little bit of some of the financial support that's come in?
Well, there's so many people who've stepped up and provided us funds to be able to focus on particularly the testing, the tracing, and the treatment phase that we're implementing here. So many different donors have, at our call for getting scholarships for our most marginalized population. The Supreme Court came out with a DACA ruling, and so we've got scholarships for DACA and undocumented students that we're constantly raising money for. But in particular, several people have stepped up and given us money that I think Joyce, when she had the idea of rolling this encounter notification system out, she said, well, this is going to require some resources. We are obviously in very tough financial times at the university, so our donors have come forward, and individuals like Andrew Brachia has been very generous in providing money to help us, and others, many others, to be able to have some money that Dr. Dake and I could use to help some of these testing protocols, some of the contact tracing, and also in the treatment phase. So we're incredibly appreciative, and we need the help right now for scholarships for our students, for just basic needs for our students, and for the support of some of these innovative approaches we're taking to testing, tracing, and treating.
Thank you, Dr. Robbins. There's no doubt that this is a difficult time for all of us. As you panelists well know, you're working on different areas to find solutions to some of these problems. There's been many sleepless nights for the folks here at the University of Arizona and the experts on crisis management from our community who have all come together. But they are actually working on all our behalfs, and we do thank all of them. This wraps up our session for today. Don't forget, we'll be back here on next Thursday, 10 o'clock. Oh, one more question.
Daily Wildcat, can you hear me okay?
Yes.
Yes.
Okay, great. So last week, the Coalition for Academic Justice set up a press conference to propose their new furlough plan that contradicts the university's furlough plan. I was wondering what your overall response to some of the concerns they brought up was.
Yeah, I have seen the table in the plan, but I haven't looked in detail at it. I know that Lisa Rolney has a task force that has wide university representation, and that alternative furlough plan is being evaluated by that task force. And I'm waiting to hear what the response would be from them.
Thank you. Appreciate the question. One other question, Dr. Robbins, before we sign off. A lot of universities around the country have decided that come Thanksgiving, that will be it for the semester, that students will not have to come back after that period. Has there been any discussion here at the university on what will happen?
Yeah, so we discussed many different options, and unfortunately Provost Folks is not here, but she and her team have consulted with the university leadership and shared governance leaders about going to a quarter system, because that gives you a lot of flexibility with an obvious break between quarters. But we determined that we would stay on the semester system. That's one thing. The second question is, could we start earlier? We didn't think that we could accomplish that for a variety of different reasons. And the third was, there's a period of time after that, that break where I think it's 7 or 8 days that classes would happen. So we figured out, Provost Folks and the leadership has figured out a way that when students complete classes before the break, they could go back and finish the semester out in a digital format.
At Thanksgiving.
At Thanksgiving, yeah.
Wonderful. Thank you, Dr. Robbins, and thank you, everybody on the panel. It's time for all of you to get back to work and find some more solutions. That's it for this session, and do not forget, we'll be back every Thursday, 10 a.m., hopefully from this same location. If you've missed some of this broadcast or you want to share it with a friend, it will be online at the U of A YouTube channel, and you can get to it simply by going arizona.edu/live. Thanks so much for joining us. Have a good day.